my pleasure to introduce Katina Beard, with the Matthew Walker Comprehensive Health Center, talking about dental services for people in our community. You've been around, not you, but they've been around in our area for nearly
almost 50
half a
years.
century.
Founded in 1968 by Dr. Matthew Walker, who was a surgeon at Meharry Medical College at the time.
Okay, and it has evolved over the years to provide a variety of services. So tell us more about it for people who aren't aware of what all you provide.
Yeah, so we are comprehensive, hence our name, Matthew Walker Comprehensive Health Services. So we have medical services, dental services, diagnostic services with radiology and lab services. We have behavioral health services, case management, outreach and education. We have a pharmacy in our Nashville location. Just a long list of services. We have nutrition, which also includes now a food bank for people who need access to food.
Wow. So started originally to provide services for people who had no insurance.
Yeah, so it was started in 1968 in North Nashville, primarily for North Nashville residents. It served as a place for people to receive care, for people to be employed, for people to receive additional services that were not always met at the doctor's office. And so we've really kept his mission and his vision alive, because we trained several students through our facility, several residents, and different disciplines, clinical and non-clinical. We try our very best to employ from the Nashville community and to put back into our community. And we've continued our mission to make our services comprehensive and affordable to those who are uninsured.
So, and it's based on a sliding scale.
It is. It's based on a person's income. So they would bring in their income, some verification of their income, and tell us how many people live in their household. From there, we would determine what their eligibility is, and that would be their eligibility to pay. And all of our services are based on an individual's income.
Okay. Tell me more about, let's talk specifically about the dental care. I know that's what we want to focus on primarily today.
Yeah, so we have a dental clinic in our Nashville location and in our Clarksville location. We provide, I would think, a full array of dental services in our oral health program. And so we have a hygienist on site, and so you can get your teeth cleaned, and we have dentists, and so we can do simple extractions, some more difficult extractions. We do basic root canals, of course fillings. We can do crown work, partials, dentures. We always want to keep our children's teeth clean, so we want to do fluoride and sealants on those teeth to make sure that they stay healthy. So we're able to see the entire family for their oral health needs.
That is fabulous. Why does dentistry play such a big role in our overall health? I've always heard that it's very important to our heart health because of all the bacteria in our mouths.
Yes, particularly for our patients that have hypertension or heart disease or diabetes, because the oral health and the disease in the gum can affect their blood sugar or their blood pressure in many ways, and it just leads to other different diseases in the body. And so we want to make sure that the teeth are healthy and that the mouth is healthy.
And earlier you start obviously teaching good preventive methods
Absolutely.
As far as flossing,
brushing, flossing, coming to the dentist twice a year. People kind of want to just only come when there's a problem, but come beforehand. It is definitely something that if you are preventive minded about, it would be much better in the long run.
Absolutely. How do you coordinate the dental services with other services that the Matthew Walker Centers offer?
So we are an integrated model, and so our dental services and our medical services, radiology, all of those services I spoke about earlier, are all integrated into one building in Nashville and in Clarksville. And so our patients just go from one floor to the next, and so they never have to leave our building to receive a lot of the services. And so that's what's unique about what Matthew Walker does, in that we house a lot of our services in one location, and that is a cost savings to the patient. It's a cost savings to the insurance payers, because it's not all of that additional coordination of care outside of our walls. And so it's really a great model that helps all around.
Describe, if you could, I don't want to say your average, your typical client, but if there is that person that you see more of, is it someone elderly? Is it
the majority of our patients are older adults. I would probably say, I don't want to be offensive, but 50 and older. I know people 50 is young, so 50 and older I think is our highest number of patients that we see. A lot of them are working but uninsured. And so they're able to receive care and pay for their services, but they just don't have coverage. And so we want our services to be available to people so that they don't end up in the emergency room with this extensive cost unnecessarily. So that's our average patient. We also accept insurance, and so we want people to know that we accept their insurance also, and they can come into this integrated model of care also.
Okay, so again, it's not just uninsured,
It's
but
not just
underinsured.
Underinsured, uninsured, and fully insured. And so we're there available to our community in Nashville. We know our neighborhood around us on Jefferson Street in North Nashville is changing, but we want people to know that we're there for the full community, to keep the full community healthy.
You mentioned Clarksville. Where else are you?
We're in Clarksville at 230 Dover Road in Clarksville, and that has medical and dental services. And then we are in Smyrna at 739 President's Place, and that is our medical office, which is largely our prenatal care program, which is a wonderful program with all of our new moms. And we also have adult medicine, and we just have most of the services there except dental.
Are they able to get in fairly quickly for services? Is there much of a waiting? You know, so many physicians' offices, you have to wait a while.
Yeah, now honestly, dental is a little bit of a wait because we have a lot of people needing access to affordable dental care. And so we do have just a little bit of a wait, but we have 3 dentists in Nashville and 1 dentist in Clarksville, and so we could get people in pretty soon. Once again, come before you're in a lot of pain.
Yes.
And they can always give us a call for all sites at our main number at 615-327-9400.
327-9400.
Yes.
Okay, and I know we've been putting up the website under Katina's name throughout
Yes.
the
They can go to the
segment.
website and get more information. Send us an email. We'll reach back out.
Great. Katina, thank you for enlightening us because I had not heard of it, which means, you know, I'm sure a lot of our viewers haven't. So thank you for educating us and for all the good work you're doing.
Thank you.
All right.
Thank you.
And we'll be back in just a moment.